Morning and welcome to another webinar organized together with Clementi Salon Supplies. We've already had the opportunity to meet twice before. Our first webinar focused on Purles products with plant exosomes, while the second one was dedicated to chemical peels, including all year-round peels therapies. So today, I'm excited to introduce you to MesoCocktails available in the Purles Professional portfolio. I also encourage you to watch our previous webinars because Purles products are designed as effective treatment therapies that really deliver visible and long-lasting results for our clients. My name is Joanna. I'm a cosmetologist and an international trainer for the Purles brand. And during the next hour, I will show you what makes our MesoCocktails unique and why they are worth introducing into your salon treatments. And just a quick information that after today's webinar, you're going to have 10% discount to all of our Purles MesoCocktails in Clementi Salon Supplies using code MESO10. So let's begin. But before we move on to the products themselves, I really would like to briefly remind you what microneedling mesotherapy is, why it is considered one of the most effective anti-aging treatments, and for which skin concerns and conditions it can deliver the best results. I know that you are a specialist, maybe you know all of those information, but it's good to remind ourselves sometimes even this basic information. So to start, the beginning of the microneedling dates back to the 1990s. So it's already a long time ago. Then the simple rolls were used in the treatment of post-acne scars. Over the time, of course, the technology evolved, the cosmetology evolved, introducing electronic devices with, of course, this precise parameter control and disposable sterile cartridges. In my opinion, microneedling is one of the most effective anti-aging therapies in a beauty salon. We distinguish different types of mesotherapy. So what's the difference? We have the needle mesotherapy, where a single needle is used to inject the product directly intradermally. We have non-needle mesotherapy based on phenomenon of electroporation, where the cell membranes temporarily loosen, and this allows active ingredients to penetrate directly into the cell. And we have microneedling, which uses multiple micro injuries to stimulate the skin. To fix, sometimes you have to break. I think this concept perfectly reflects how microneedling works. So by creating those micro injuries that, of course, are visible to the naked eye, we stimulate the skin's natural repair processes. So each of these tiny injuries triggers a cascade of biological reaction that leads to tissue regeneration, right? So in fact, the mechanism is very similar to a natural wound healing. And during this treatment, during just one facial treatment, we can create over 2,500,000 microchannels in the skin. And Those microchannels not only stimulate the collagen and elastin production, but also significantly enhance the absorption of the active ingredients, of course. And as a result, the skin becomes more firm, more smooth, and of course, rejuvenated. So we already know that one of the key advantages of microneedling is the significant increase in product absorption. So substances applied to the skin can penetrate up to 1,000 times more effectively compared to when we just applied on the surface of the skin, for example, during the massage. This means that during the microneedling, we can dramatically improve the bioavailability of active ingredients. So as a result, again, skin is able to utilize these substances much more efficiently, and this enhances the overall effectiveness of the treatment. Here on this slide, we see the influence of the mechanical treatments on the effectiveness of penetration of active substances. So CF goes to a substance that is well soluble in water, and DIL, it's a substance that is well soluble in fats. So on the first 4 pictures, you can see the application on the surface of the skin. So first 2, just a normal application, we apply the products and we leave it on the skin. Then the second one, we perform the massage. So we improve the circulation. We would think that all those products go deeper to the skin. Well, here on these pictures, we can't see it really. And then we apply the substances using ultrasounds. We know that the ultrasounds create the channels between the skin cells, so the products, the absorption, it's much better when we use the ultrasounds. But again, it makes a little bit of difference, but then we have the application after dermabrasion. We can also see that some small changes into the skin that, we remove the surface of the surface layer of the skin, and of course the absorption of the product again going to be better. But the last is the application with the microneedling. And look at this picture, how much it's going on here. There is this cascade of biological reaction. So the most effective of these methods turn out to be micropuncture of the skin. Here we have a depth of 1 millimeter, and we can see that the penetration of the products was increased by over 200%. That's why this treatment is so effective. When we can perform microneedling, in which kind of skin concern would be the best this method? For example, for melasma and even skin tone hyperpigmentation. Why? Because microneedling normalizes the activity of melanocytes, and this helps lighten discoloration, even out the skin tone, even in such a difficult cases like melasma. What is important is that this technique is even safe for darker skin phototypes. Compared to this to lasers, laser methods can cause hyperpigmentation. Absorption of active substances. I already said that during the treatment, microchannels act as a temporary access routes for active cosmetic and therapeutic ingredients, thanks to which skin absorb various types of substances much more effectively. Enlarged pores. In my opinion, personally, I think this is one of the best treatment for enlarged pores. Of course, not after first treatment, but if we do the series of treatments, so we say 4 to 6 treatments, we can definitely see the results. The pores are smaller. The surface of the skin is more smooth. Alopecia. The newest research said that it's very, very effective. Why? Because microneedling improves circulation in the scalp as well. And if we improve the circulation, we stimulate hair follicles. A significant, really significant increase in hair density can be observed after regular treatments. But just remember that the depth of the puncture should be minimal to avoid damaging of the hair follicle. Minimal, it's mean 0.25. Thanks to the stimulation of fibroblasts, the skin becomes more firm, more elastic, of course, because fibroblasts stimulate the collagen and elastin production, our base proteins of the skin. Reduction of scars and stretch marks. Microneedling effectively improves the appearance of acne scars. Both also these surgical ones, these post-traumatic scars. This treatment works also very well on stretch marks. And of course, the risk of post-inflammatory discoloration, it's minimal. And microneedling, it's very effective when we combine it with another treatment. So it's an excellent base for synergistic therapies because it increases the effectiveness of the penetration of active ingredients we apply on the surface of the skin. So try to always combine the microneedling with other treatments, like for example, chemical peels. If you were on our last webinar about chemical peels, you know that we can combine the chemical peels with the microneedling. So first, we perform the chemical peel, then we remove it, we neutralize, and then we can perform the microneedling. This is the best way to achieve the best results. This is also the great treatment for enlarged pores as well. And we know that in microneedling, we have the kind of mechanism of action, what is going on in the skin. So we have 3 main phases in a microneedling. So in the first phase, this is the inflammatory response. It's going to last up to 72 hours. So in this phase, in the inflammatory phase, the platelets are activated, where they gather at the site of the injury and they release the growth factors. Then we have the neutrophils and macrophages, which they clear the injury site of the cellular debris and start an immune response. And then, of course, the cytokines are released, which stimulate keratinocytes and fibroblasts. So here in this first phase, there is lots of going on in the skin. The second phase is the proliferative phase, and it can last from the 3rd day after the treatment up to 21 days. So here, the fibroblasts multiply intensively, producing new collagen and elastin fibers. Of course, the new blood vessels are formed, so we call it in cosmetology angiogenesis. And if we have angiogenesis, this improves microvascularization and, in the same way, tissue oxygenation. We can definitely see in this phase visible regeneration of the epidermis. And if we would be able to look deeper into the skin, we can see the structural reconstruction of the dermis as well. And the third phase, the last phase, which is going to last weeks or months after the treatment, it's the remodeling phase. In the remodeling phase, collagen fibers are rearranged. The type 3 collagen is gradually replaced by the type 1 collagen. The structure is strengthened. So the skin builds already this base into the skin. And this means that skin is going to be more smooth, the pores will be reduced, and the skin tone and the texture of the skin will be improved. And this process can last up to 12 months, meaning the effects of the microneedling treatment can deeper over the time. So it's really good information for our clients that the effect of the treatment are permanent and not disappear after 2 or 3 days. But most of these effects happen inside of the skin. There is this biological reaction inside of the skin. So then we can achieve overall rejuvenation. But this is how it's supposed to be told to the client. Yeah, this information that the effects are permanent. And if she's going to continue the treatment, we're going to get even better results. Therapeutic window. What is that? Maybe some of you know what is that therapeutic window. If you know, please tell me, write on the chat section. Okay, I will tell you then. Therapeutic window refers to a period of time when microchannels in the skin remain open. So they act as a gateway for active substances. And this period is used for the application of mesotherapy serums, ampules, and this allows for the transport to created channels. And how long is this therapeutic window? How long the microchannels remain open? Because there's lots of different information on internet. So now I will tell you the truth. They remain open and function for approximately 4 to 30 minutes, depending on the, of course, intensity of the treatment, the type of skin, the skin thickness, the device we use. And this partial closure occur within half an hour, let's say. So this is also the answer for our clients if they ask, can I apply makeup after the treatment? No, you may not, because you have this microchannel still open on the surface of your skin. And you want to apply all these bad ingredients from your makeup, from your foundation of the injured, on top of the injured skin. So no makeup after the treatment. The techniques. The techniques are also very important. Accordingly, the newest research, the point technique, the stamping technique, it's the most effective. Why? Um, well, not necessary. More punctures, more pressure, it's better. Why? Because this can create too much damage. This can create wrong regeneration process of the skin. And if we have a wrong regeneration, there is an imbalance in a proportion of collagen produced, and the skin can become quite hard. Another thing is if we use linear or diagonal or circular movements, when we move the dermapen, when we move it over the skin, sometimes there will be a moment when the needles are in the skin and they stuck into the skin because, for example, our device is too slow. So to avoid that, choose the most effective technique, which is point stamping technique. Of course, if you have a great device, if you have a medical device, you can perform all of those techniques. But if you know that when you perform the circular movements, the needle can stuck into the skin, go with the point technique, stamping technique. The length of the needles. This is also a very important topic because on our skin, on our face, the skin has a different, can be thinner, can be thicker. So it's good to remember that we have to adjust the length of the needles during the treatment to the area we work on. So in microneedling, the selected device depth, it's not the same as exact skin penetration depth. So deeper settings may increase, for example, tissue trauma and not always improving topical ingredients delivery. That's why shallower depths are often sufficient for transdermal absorption, whereas the deeper treatment, so the deeper length of the needles, we use when we, for example, work with the scars, when we work with the stretch marks, when we have the post-acne scars, for example, then we need a deeper work with the microneedling. Does it matter the number of the needles in the cartridges? What do you think? Does it really matter? Let me know, yes or no, in the chat section. Doesn't matter what kind of cartridges we use, or it's not important. We can choose any of those, and the treatment will be effective. What do you think? Okay, so I will tell you, yes, it does matter. It does matter definitely. Why? Because with the nano cartridges, we work if we would like to increase the absorption of the products. This is the main goal of those kind of cartridges. Nano cartridges are also great for very sensitive skin, very thin skin, because we can perform microneedling on actually almost on all of the type of the skin. We cannot perform microneedling when you have active acne, for example. But for sensitive skin, vascular skin, yes, we can perform microneedling. Then we have 42, 36, 24 cartridges. And those will be great for skin with a hyperpigmentation, with uneven skin tone, but also for the sensitive skin. 16, 12, and 9, these are really anti-aging cartridges. So perfect for mature skin when we want to work, when we want to stimulate fibroblasts to stimulate the collagen and elastin production. Perfect if we want to work with the post-acne scars and stretch marks. There are also cartridges with one needle, which are also good. Then we perform then the micropuncture, which we use, for example, to treat the post-acne scars also, or the stretch marks. Contraindication. You are a specialist, so you know all of those contraindication. They are like a basic contraindication for the microneedling. We know that we do not perform microneedling during the pregnancy, during when we have rosacea, psoriasis, active acne, skin cancer, etc. Here we have also diabetes. Yes, diabetes is considered as a contraindication to microneedling mesotherapy, especially if it is unstable. The main reason is there is an impaired healing. So diabetics have a poorer circulation. They have slower tissue regeneration, and this can increase the risk of complication, and there can be a higher risk of infection. Post-treatment recommendation for the clients. It's also very good to give the clients a small piece of paper with all those post-treatment recommendations. Because as a specialist, you know, when you perform the treatment and you tell the clients all those important information after the treatment, when they leave your beauty salon, after 5 minutes, they do not remember anything what you just said to them. So it's good to give piece of paper with all those information, how they should take care of the skin after such a invasive procedure. You know, we hurt the skin, so the skin is injured, so it's kind of let's say invasive procedure. Then inform the guest, inform the clients that they can experience the redness, that can experience the swelling, dryness, burning sensation. The skin can peel after the treatment. There can be some visible marks from after the treatment. So always avoid scheduling this treatment before some important events. Ask the client what products the person will use after the procedure. We always, of course, should recommend after the treatments the right products for our clients. But if you do not ask, if you didn't do the consultation card, for example, she can come back home and use the cream with the retinol. And then she can end up with the inflammation. You know, so it's good to know what our clients are using, what is their home skincare, to be sure that the treatment will be effective and the results will last long and there will be no inflammation. There will be no side effects. Another thing, what we should mention to our clients is that she should, of course, avoid before and after drinking alcohol and do not take the blood thinning medications like aspirin, for example. They should maintain strict hygiene. So change the pillowcases. Use the gentle towel or paper towel to rub the skin, to dry the skin. Disinfect the phone. We are on our phones all the time, so disinfect the phone. Do not cuddle with your animals at home. Do not use any exfoliants or perform hair removal until the skin is complete it's healed complete. And of course, do not wear makeup and avoid the sun exposure, sauna, swimming pools, intense exercise until the skin is fully healed. They always ask if I can exercise after the treatment. Well, it's up to you, but if you sweat, you can get inflammation. This is the point, because again, skin is injured. Another point is the beauty care, what I mentioned already before. So tell the clients that they should use the gentle washing product with physiological pH to moisturize the skin, to hydrate the skin, to use some regenerating products, and of course to use SPF at least 30 after the treatment. Okay, that was a quick reminder after about the microneedling. I hope you got some fresh knowledge from that as well. Let's move on to the MesoCocktail skin therapy for microneedling from Purles brand. So Purles offers 6 different types of MesoCocktails. There's a 6 different type of MesoCocktails in our professional portfolio. And actually, this allows you as a specialist to tailor the treatment to clients' skin needs. Most of them are packed in boxes containing 10 ampoules, each of 5 milliliters. 5 milliliters, it's more than enough for the face, neck, and décolleté. All MesoCocktails are designed for manual application, so we can apply it on the surface of the skin and leave it on. We can perform a massage, or we can use high-tech devices, such as, for example, ultrasounds, non-needle mesotherapy. But of course, we know that the microneedling it's very effective, so they are designed also for microneedling treatments. None of our products are intended for injection. So none of our products, none of our ampoules from Purles portfolio are intended for injection. And what is the characteristic features for our MesoCocktails? It's the brown glass. If the product is in a brown glass from Purles portfolio, that means it's sterile and you may perform microneedling. Why I'm mentioning this? Because Purles offers also skincare ampoules, which are in a white glass, for example, from the microbiome set. And these ampoules with a white glass are intended exclusively for manual application only, not for microneedling. So all of those ampoules in a brown glass, they are still real, and you can use it for microneedling as well. And the first product from the Purles portfolio, from the MesoCocktail, it's the anti-aging MesoCocktail, number 81. It's really anti-aging MesoCocktail. It's recommended for mature skin with the visible signs of aging. Why? Because here we have DMAE. DMAE, it's a organic compound from the group of amino alcohols. It's also the precursor of the acetylcholine. So it's going to increase the surface tension of the skin. So it will help firm the skin and maintain this long-lasting lifting effect. It minimizes the wrinkles, improves the skin texture. And here in this ampule, we have 3% of DMAE. Then we have the arginine. You know that the arginine, it's a hexapeptide. It's a peptide inspired by a Botox-like mechanism. It's non-toxic, works at the level of neuromuscular synapses, and will cause the relaxation of the facial muscles. Those muscles that cause the formation of the wrinkles, right? Using the arginine, it's completely safe and at the same time very, very effective. But then we have also the pyruvic acid. We know how effective pyruvic acid can be on its own. And here, thanks to that, we can brighten the skin. But also, pyruvic acid, we know that has a sebostatic properties, antimicrobial properties. So it's going to regulate the sebum production as well. So it will be great also for mature skin, but oily skin. And of course, it's going to stimulate the collagen and elastin production as well. And the L-carnitine, naturally occurring amino acid, it will also increase the elasticity and general condition of the skin. It's going to stimulate the cellular metabolism. So perfect as an anti-aging treatment if we have a lady after 40, let's say, with mature skin, with visible signs of aging, then we go with the anti-aging mesococktail. And as you can see on the slide, the strength, it says that it's sterile and we can apply it manually or using the high-tech devices or microneedling. The second mesococktail is the firming mesococktail, number 82. And here also we have DMAE, but here we have we have 1% of DMAE. DMAE has also very specific smell, kind of fishy smell. But during the application, the client can smell it, and we as a specialist, we can also smell it. But after the application, we finish the microneedling, this smell disappears, so it doesn't bother really the client. Then we have cilantro. That's very interesting ingredient because it smooths the skin, give us kind of velvet smoothness, kind of film forming, more than like a silicone skin. After that, it's really, really smooth. And then we have sodium DNA. Sodium DNA will protect the cells from damage caused by the UV radiation. But the firming mesococktail, of course, we can use for the face, neck, and décolleté. But it's a great mesococktail to use it also on the body. And we do recommend to do that. So combine it with acid, for example. Perform the chemical peels first, like pyruvic acid or glycolic acid, and then perform the microneedling. Of course, I'm talking about the body now. So perfect for loose skin on arms, on the belly, on the thighs, wherever the skin needs to be firmed and smooth. So perfect to improve the elasticity, not only on the face, but also on the body. Vitamin C mesococktail. Here we have 20% of ascorbic acid. We know that ascorbic acid, it's a great antioxidant. But ascorbic acid also maintains the correct structure of blood vessels, increase the amount of hyaluronic acid in the skin. It protects against premature aging, brighten the skin, strengthen the blood vessels. So, for who it will be? The ideal client will be client with a dull skin, smoker skin with an uneven skin tone, but also for oily skin where there is a poor circulation. And we know that the oily skin very often have a poor circulation. They're kind of yellowish or grayish. So then we can go with the vitamin C mesococktail. We have 20% of vitamin C here. So just to remind you that not every skin will tolerate well such a amount of vitamin C. If the skin is sensitive, it's better to use, for example, this mesococktail, combine it with the ultrasound, not with the microneedling. Yeah. If you were present on our last webinar about the chemical peels, maybe you remember we have Purles have in our portfolio F-Peel. F-Peel is with the ferulic acid, 10% of ferulic acid, lactobionic acid, and fluoretine. So we can combine the vitamin C mesococktail with the ferulic acid, like literally, we can combine them. So then, if we want to achieve the maximum glow, which is so trendy now, on our own client skin, then mix it 2.5 milliliters of the vitamin C mesococktail with the 2.5 milliliters of ferulic acid in a small bowl. Apply it on the surface of the skin, of the client's skin. Then it's going to be about 4 layers. Ferulic acid, it's alcoholic, so it's going to alcoholic solution, so it's going to evaporate after each layer. The skin can be sticky a little bit, but every, let's say, 2 minutes, we apply the next layer. Then we can wash it off or just leave it on and then apply the rest of the vitamin C mesococktail and perform microneedling. If you would like to perform microneedling, then the first 4 layers needs to be washed off. We do not have to neutralize it because ferulic acid is an alcoholic solution. So when the alcohol evaporates, it stops work. But it's a very, very effective treatment, really. If your clients like this glow skin, this glow effect on their skin, really recommend to try it. The next mesococktail is the anti-time mesococktail, number 84. Here we have the idobenon. Idobenon, it's a synthetic coenzyme Q10. It's a very powerful antioxidant, very powerful anti-aging substance. It's a similar action to coenzyme Q10. So we're going to get the reduction of the wrinkles, increase in amount of collagen, and better hydration of the skin as well. We have taurine. It's a cysteine derivative that helps maintain the structure and permeability of the cell membranes. So this will restore the vitality to the skin. It supports the production of collagen, of course, prevents aging and regenerates the skin. Taurine also prevents formation of free radicals. So it's very strong antioxidant. Hyaluronic acid, vitamin C. Here we have 2% of vitamin C. Of course, these ingredients gives us hydration, strong antioxidant properties. So what kind of clients will be ideal for anti-time mesococktail? Well, anti-time, it's perfect for actually all skin types. If we don't know clients yet, the skin clients, but first and foremost, when we see the first signs of aging, when clients come back from vacation, we see skin is dehydrated after the summer. That will anti-time also will be great here. Perfect for young skin, dull skin. When we see some small dark spots, sunspots, and when the skin needs this, it's in need of antioxidant, then we go with the anti-time mesococktail. And next one is the purifying mesococktail. And here we have also 10 ampules, but in a purifying mesococktail, those ampules, they have 2 milliliters. 2 milliliters, not 5 like the other ones. Yeah? But here we have salicylic acid and niacinamide. We have 2% of salicylic acid. We know that it's a beta hydroxy acid, so it's going to penetrate the sebum layer. It's going to restore the proper functioning of the sebaceous glands, cleans and narrow the sebaceous filaments as well, reduces some discoloration, but of course, it's a great antibacterial ingredient. Niacinamide, we know how niacinamide is popular now but for a reason. First and foremost, it's a stable component. So niacinamide has anti-inflammatory properties, but also it's going to increase the synthesis of ceramide in the skin. So it's going to hydrate the skin. Will also increase the synthesis of the keratin, filaggrin, involucrin. So all those good envelope proteins, which optimizes the skin barrier. So together they create perfect mixture for oily skin, acne-prone skin, skin with the post-inflammatory hyperpigmentation, but also for post-acne scars. If we want to work with the post-acne scars, we should go with number 13 purifying mesococktails and perform the microneedling. And last but not the least is Tranexa Bright Mesococktail. And here, as you can see, it's not an ampule, it's a vial. And in the box, we have 5 vials of 5 milliliter. It's our spring novelty, Tranexa Bright Mesococktail, with 5% of tranexamic acid. Tranexamic acid is a very popular ingredient. It's very effective ingredient. It's used in medicine for years to stop bleeding, for example, after operation, after birth. But here, tranexamic acid, it's not a tyrosinase inhibitor. It's not the keratolytic acid. It's not going, your skin is not going to be, not going to peel after application of tranexamic acid. Tranexamic acid, it's a plasmin inhibitor. Plasmin, it's an enzyme in the blood plasma involved in the dissolution of clots. So it's very effective for discoloration with the vascular components. So perfect for clients with a post-inflammatory erythema. With melasma, melasma is always greater vascularity. Why? Because tranexamic acid reduces vascular epidermal growth factor. So it shrinks the tiny blood vessels underlying the spots. This calm redness that often fits and sustain condition like melasma. Perfect for clients with rosacea, of course, in this first two stadium, not when there is an inflammation, yeah? Perfect for clients with a flushing erythema, when clients has an uneven skin tone, when clients always have red cheeks, not because of the disrupted hydrolipid barrier, because it can happen as well, but if the skin is hydrated and clients still have red cheeks, then we can go with the Tranexa Bright Mesococktail. Perfect for dull skin, sallow skin. In this mesococktail, we have also, except the tranexamic acid, which is very important ingredient, glutathione. Glutathione occurs naturally in our body, but when we age, the amount of the glutathione in our body decreased. Glutathione, it's the tyrosinase inhibitor. So blocks the key enzyme responsible for pigment formation, so the tyrosinase. We're going to effectively lighten the age spots, sunspots, and melasma. Neutralizes oxidative stress as well, gives the skin this radiant, and as a tripeptide going to stimulate the cellular DNA repair process, which is very important, especially if we perform the microneedling. And the carnosine, it's a dipeptide. Carnosine inhibits the glycation process. So it's going to work as an anti-aging. Prevents the development also of this yellowish tint characteristic for the glycation aging process. Very powerful antioxidant. If you have a client with melasma, with rosacea, with post-inflammatory erythema, post-inflammatory hyperpigmentation, then this is the perfect solution for this kind of clients. Quick overview with the mesococktails. Sometimes it can be difficult for us as a specialist which mesococktail will be the best for my client. For example, I have a client, she is 45, and I have those anti-aging and anti-time mesococktails, and which one should I choose? So let's summarize this knowledge about all the mesococktails. So you can see the name of the mesococktail, the number, the indications, and the active ingredients of all the Purles MesoCocktails. So maybe it will be easy for you now to distinguish all of those products. So we have the most frequently asked question is about these two mesococktails. So 81 and 84. When should I use 81? When should I use 84? So if we look at the anti-aging ingredients in 81, we can see like Botox-like substances, right? Like a classic lifting anti-aging ingredients. So we target the visible wrinkles, visible signs of aging. We have here pyruvic acid as well. So strong skin stimulation. It's a typical anti-aging treatment designed for mature skin with visible signs of aging and loss of firmness. Anti-time mesococktail, as I mentioned before, is perfect for clients who have just returned from vacation, especially from tropical countries where the skin was exposed to intense UV radiation. So in this case, we most often observe the typical signs of photoaging, such as dehydration, fine lines, hyperpigmentation, dullness, and first visible signs of aging. But then we have the firming one, so 82. So as I said, 81 and 84 have DMAE, yeah? So strong lifting and anti-aging effect. 82 as a firming mesococktail, we can use it for the face and body as well. Yeah, so anywhere when we want this firming effect, anti-aging mesococktail will also give us this firming effect, but it's more about stimulation the skin. Yes, more about stimulate the production of collagen and elastin fibers, more about this lifting effect and firming anywhere when we want this firming effect on the face and on our body. And then we have the vitamin C mesococktail and Tranexa Bright mesococktail. So you have a client with a hyperpigmentation. Which should I choose? Vitamin C, it's a strong antioxidant, but also for hyperpigmentation, right? Also for uneven skin tone. But then we have a 34. 34, it's best for melasma, it's best for post-inflammatory erythema, it's best for post-inflammatory hyperpigmentation, for rosacea. Everywhere there, we have the vascular skin, the greater vascularity, the skin prone to irritation, the sensitive skin. This is the best ingredient to fight with such a condition, Tranexa Bright mesococktail. Vitamin C, it's perfect if we have a thick skin, dull skin, yellow skin, skin with a poor circulation, non-reactive, oily skin, skin with enlarged pores, photoaging, if we want strong antioxidant effect. It's a great ingredient, but just remember that some clients can overreact for 20% of vitamin C. But of course, there will be some skin types that you can use both. We do not mix the mesococktails, but your specialist, you do the beauty plans, right? When the client sits on your chair in the beauty salon, you already think what's gonna be next. What's gonna be the next step for our client? What I can perform, what kind of treatment I can perform in the next visit, right? So you plan the treatments for your clients in advance. So for example, one day in one treatment, we can perform microneedling with a Tranexa Bright mesococktail if there is redness to calm down all this vascularity. And then, for example, if the clients want to work on some sunspots, we can perform the microneedling with the vitamin C. So clients know in that case that the treatment is tailored, is individually, you treat them individually. So they know that you are taking care of them. But then we have the purifying mesococktail. As I said, we can use also for post-inflammatory hyperpigmentation. Purifying mesococktail with the salicylic acid and niacinamide work best for acne scars. So if we have a clients with the acne prone skin. Yeah, we started from restoring the hydrolipid barrier because most of the teenagers with the acne, they have disrupted hydrolipid barrier. And this is the first step we should start on from. Then we move to acid peels, for example, to work antibacterial. And then there is no active acne. We can perform microneedling because we have some post-acne scars. This is the perfect moment to use number 13, purifying mesococktails. So we can perform the micropuncture or microneedling on those atrophic deep scars to work on deeper layers of the skin. Of course, still taking care of the hydrolipid barrier. I'm a visual learner, so maybe this diagram will also helps you to better remember which mesococktail we should we should place which mesococktail, which one we should choose. So anti-aging mesococktails, it's 81, 82, and 84. If we want to work with the antioxidants, we want to achieve this antioxidant effect, then we can go with the Tranexa Bright Mesococktail or vitamin C or anti-time mesococktail. If we have some sun discoloration, depends. If there's some only sunspots, then we can go with the vitamin C. If you see that the skin, it's a vascular skin, then we go with the Tranexa Bright Mesococktail. Then the acne discoloration, it depends. If we have post-inflammatory erythema, if we have this greater vascularity, or skin prone to irritation, then we go with the Tranexa Bright Mesococktail. If we have a post-acne hyperpigmentation, because our client didn't use the SPF cream, and post-inflammatory erythema created post-inflammatory hyperpigmentation, and there is some post-acne scars, then we go with the number 13, purifying mesococktail. And oily skin, of course, purifying mesococktail. Okay. If you are unsure which mesococktails work best for you, a great way to try them all actually, is the limited edition of Discovery Set Mesococktails. I mentioned it during the first webinar, but since the set consists of mesococktails, I will mention it again. So this is a limited edition for professional. It's a professional test set for you as a specialist. This will allow you to discover all those 6 Purles mesococktails, designed for microneedling, of course, and other methods like ultrasound, no needle mesotherapy, or just surface application. The set makes it possible to test different skincare directions in a kind of economical way, and choose the solutions that best meet the needs of your clientele. So you can check the smell, the consistency of each mesococktail, because the biggest advantage of it is flexibility and personalization, because it allows you to explore all those mesococktails and choose the right one for your clients. So ideal way to try it all, and without having to stock up on every ampoule right away. It's a limited edition, so if you want to try it, don't hesitate too long. But as you can see, we have this number 13 with the 2 milliliters of solution, 81, 82, 83, and 84 with the 5 milliliters of solution, and Tranexa Bright Mesococktail in a vial also with a 5 milliliter solution. A quick review of the home care. This is just an example. If you haven't tried any of Purle products, I really encourage you to do that. So before so as a home care for the clients, it's great to recommend the cleansing products. Of course, here we do recommend the cotton foam cleanser, but of course it could be also, for example, Centea face cleanser, which is our newest cleanser from in Purle portfolio. Then as a day cream, because skin is injured, then we do recommend a cream and elixir from a Sensi Skin Garden line, so soothing elixir and soothing cream. As a night cream, Exofusion face cream, or EGF youth cream with epidermal growth factors, Exofusion face cream. If you watched the first webinar, you know already those products with the plant exosomes. Eye cream as an exofusion. Eye cream with the exosomes from Momordica carantia. Perfect cream for a dry, dehydrated, mature skin with a kind of buttery consistency. I absolutely love this cream. And of course, SPF here, if you have a client with a dry skin, then we can go with the 122 brightening base because it's very hydrating SPF, and also give us a nice glow because it's a tinted SPF. So skin looks really, really nice after the application of 122. 171, it's a mineral sunscreen with an SPF of 30. If you have a client with the oily skin, then we can go with 155 to give this a mattifying effect. And of course, we can add to that the additional care as a cream mask, for example, 156 as a SOS cream mask, also from the Sensi Skin Garden. But it's, of course, just an example. Everything depends on the client needs, type of the skin. And some effects before and after. So we have anti-aging skin therapy, so with the 81 MesoCocktail, and we have here four treatments. We know that microneedling is very effective, and if we combine that with the good products, good ingredients, good MesoCocktails, we can get even better results. Another effect of a combination of microbiome spectrum. This is this set also with the ampules, which I mentioned before, but in the white glass. So we just apply it on the surface of the skin. We have M peel and A peel. We have S peel here, A peel again. So these are our chemical peels. And the last treatment was with the number 13 purifying mesococktail. And this is a perfect example of this, what I told you before, if we have an acne prone skin. So first we work with the microbiome. First we work with a hydrolipid barrier. We hydrate the skin. Then we work as an antibacterial. We work with the antibacterial treatments using the chemical peels. And then in the end, we perform microneedling. beautiful results after such as a combination of the beauty plan, actually. Here we still have some post-acne scars and post-acne discolorations. So we're gonna work on that more because there was just one treatment with the microneedling. From another angle, here we had also the lactose intolerance in this client, the vitamin D deficiency. So she had to supplement vitamin D, omega-3 fatty acids, etc. So that was the very holistic point of view for our clients. And here, FPL, so with the ferulic acid and microneedling with 81 anti-aging mesococktail, 2 treatments. Absolutely beautiful results after just 2 treatments. So the second treatment, the second photo was done after about a month. So we perform here the microneedling with the 81, and then the second treatment was with the FP and microneedling as well. And excuse me. And in the home care, we recommend 123 the peptide cream from Purles range. Okay. Thank you very much for today. I hope it was interesting to watch it. I hope I convince you to try the Purles MesoCocktails because they are truly excellent products with really outstanding formulations, as you could see, with great active ingredients. So if you will have any questions, feel free to ask them in the chat section now. If not now, you can contact then Olga from Salon Supplies. And if she will not know the answer, she will forward the message to me or any other trainer from Purles. The webinar was recorded, so if you would like to revisit any part of the presentation or clarify something later, you will be able to watch it again at any time. And remember that after today's webinar, you're going to have 10% discount on all of Purles MesoCocktails in Clamanti Salon Supplies using code MESO10. MESO10. Eddie, thank you very much. I'm glad that it was very informative for you. I hope you're going to start using a MesoCocktails. If you will have any questions, don't hesitate. Just contact Olga or and she will forward the message to me if there will be a need. So, ladies, thank you very much for today. If you have no question, I wish you a lovely afternoon. Yeah, and good work with the MesoCocktail. Thank you.